I think data does speak greatly in the current environment. I think some degree of objectivity really helps through the data. That's number one. And number two, remember, we are still in the midst of the pandemic. It's very difficult to conclusively say anything because the science of it, particularly from the medical side, the research is still very much in the initial phases. And yet every day we are seeing new evidence emerge. So the attempt is really to piece together whatever evidence we are picking up from the data itself, while maintaining that the uncertainty from the medical research, the science of it is still an unfolding story. So bear that in mind as we see these numbers. Roshan, I think at the beginning of this pandemic story, it's important to accept one fact, which is that the case fatality rate globally as well as in India is declining, and it's declining rather sharply. And you can see that as of today, it's in the Indian context, we are our fatality rate is about just a little over 2%, and it has been steadily declining from much above 3%. So that's a good sign. And this is a consistent story across the world. Now, what are the reasons for it? Perhaps doctors now have better protocols. They know how to treat patients with COVID. Perhaps we just have a better understanding. Perhaps it's the preparedness that different countries, and particularly in India, since I'm presenting the Indian data, perhaps we have got our act together. So it's important to just see that. Second is, while we do have a fascination for looking at the overall number of cases, and as we should, everyone is, but it's quite alarming in its simplicity if we say that 17.5 lakh cases are there, while not telling people that more than 65% of that, so over almost 11.5 lakh people have actually recovered. And of course, the downside of it is that a little over 37,000 lives to COVID. Now, in the global context, we do know that, most countries, when they impose the lockdown, of course, Western Europe, the US, they impose national lockdowns after initial several weeks of rapid increase. And after they imposed the lockdown, they did see a big decline in the active cases. As against that, what we are seeing in the US, Brazil, and India is that we have not yet seen a stabilizing or a decline in the active cases. These numbers are still on an increase. And we can have a discussion on why that might be the case and what is so peculiar about the US, Brazil, and India. I might have a few hypotheses of my own. The nature of this virus is such, Roshan, everybody is susceptible. We cannot rule out any segment of the population where we can say that these people will be unaffected. So eventually, if everybody is susceptible, it makes sense to look at the infection and death rate as a percentage or in the form of per million. So population has to be weighed in when we look at the absolute number of cases and the deaths. And here, if you look at the big hotspots, which have more than 300,000 cases, India has a little under 1,300 cases per million. And that is actually quite modest if you consider that the next country, Mexico, has more than 3,400 cases per million. Countries like Chile have above 19,000 cases per million. Brazil has around 13,000 cases per million. So one is, of course, the difference in the magnitude of the infection itself. Yes, it is linked to testing, but we'll talk about it in a minute. The testing doesn't explain the entire difference. Second is the death rate, which is eventually what we're all interested in. That, look, this infection is going to grow, but eventually how much can you minimize the death due to COVID? In India, as of today, we have around 27.5 deaths per million people. Now compare that with UK, which has almost 700 deaths per million, or Chile, which has around 510. Brazil has around 450. Now these are very large numbers because while I am deflating them or giving you a sense of the population, in absolute terms, these are very large number of deaths. Now, if we had similar death rate as some of these countries, we are talking about deaths in around 9 lakh, 10 lakh deaths, and clearly India is not seeing that. But just in terms of the cases and what the data is picking out, India is reporting a rather modest death rate compared to other hotspots. We are a very large country. When we start studying all India level statistics, it's a bit naive. It's like saying this is the statistics for Europe. because every state, I mean, in India is almost the size of a country. And because we have a federal system and health is fundamentally a state subject, different states are undergoing their own sort of evolution in this epidemic. So it's important to see that there are great variations. Of course, India is largely driven by Maharashtra, which has always remained around 1/3 of total cases. And until we really get the infection under control in some of these hotspot states, like Maharashtra, Tamil Nadu, etc., it's very difficult to bring the overall infection under control. But clearly you are seeing that the other states are also now reporting an increasing number. In terms of where the new cases are coming from, again, Maharashtra, Tamil Nadu, and now Andhra Pradesh for the last 2 weeks are reporting a very significant large number of daily cases. We have managed the pandemic or the spread of the infection at sort of varying levels, with varying degree of success across different states. Today, of course, Andhra Pradesh, Karnataka, increasingly UP, Bihar, West Bengal are becoming big problems. If you look at cities or districts, really, the good thing is that districts of Delhi, Chennai are actually beginning to look good because they are reporting fewer cases every subsequent day. Similarly, if you see Bangalore is stabilizing, thankfully. Thane has actually begun to improve, which is the 4th largest in terms of cases. Mumbai has stabilized. While it's not improving, but it's also not getting out of control. So these are the broad trends in the big hotspot cities of the country. Now, while the cases might be rising, the important thing to bear in mind is the differential death rate across different cities. And this is where it's important to highlight that, Delhi has more cases than Bombay, but actually fewer deaths. So Delhi has around, under 3% death rate, while Mumbai has 5.5%. So you have to compare performance and sort of containment and effective management given these kind of metrics, not just the absolute number of cases. Again, look at Chennai. It has many more cases than Thane and Pune, but the death rate is much below all India average, and definitely better than Pune, Thane. So Bangalore too, while the cases are rising, the death rate has remained below all India levels. So those are good things. Now, the lockdowns that we have had, and we've had series of lockdowns, and even today, though we do not have a lockdown, though some states do and districts do, but the growth of the infection, if you look at the speed at which it is increasing, that has been coming down consistently. What you will notice from early June, when the national lockdown was lifted, from then we have struggled to further reduce the spread, and it has remained between 2.5% to 3%. We haven't managed to reduce it further, but that is going to be the nature of this infection, that while states are open, there is a lot of movement from industrial corridor to the eastern states. There will be movement from urban to rural areas. So while we are in the post-lockdown phase, there is considerable movement of people, and therefore the infection rate is still increasing. It hasn't really declined to a zero. So what do we know so far? We have not yet peaked, right? Unlike big hotspot countries of Europe, we have not yet peaked despite lockdown, although we have reduced the growth rate or the speed of the infection. But clearly, this cannot be an all-India story. You have to really pull apart and look at different states differently, and you will see that the performance has varied a great deal across states. In fact, it's we can say with a certain degree of certainty by comparing these statistics that, perhaps it's been a failure of tracing and the effective containment strategies that we have seen very large deaths in states of Maharashtra, Delhi, Gujarat, MP, West Bengal, and as of two days back, now Punjab. These are states that have case fatality rate which is much above the all India average. Now, beyond looking at large statistics, Roshan, it's also important because as an empiricist and who's following the global literature on this and how countries are handling it, I must say now we are 6th month into the pandemic. We really need to move beyond mathematical models. Now, while these statistical exercises are helpful in getting a picture, we now need actual estimates of what is happening at the patient level. What are the comorbidities which are particularly debilitating? Whom is this virus particularly fatal, for? The stats that we know are all from the rich countries that have come from the developed part of the world, and we do know that the virus has not been as fatal. Has had varying impacts in India, so we need our own estimates. We would like to know now from the government, from our apex research institutions, what are the exact parameters, not mathematically derived, but actual estimates from the data, right, from people's data. What percentage of our infected people actually need hospitalization? And from hospitalization, how many effectively need oxygen support or ventilators, etc. Now, those are not, they should not be left for inference from models. They should really be derived. And I think it's because we do not have those detailed parameters is why there is still uncertainty and sort of lack of knowledge about the virus in India. And therefore, the overall uncertainty around where we are headed, though the numbers are not looking too alarming, but in terms of deaths, but where are we headed? In all India, we have 27 deaths per million, but Delhi has reported more than 200 deaths per million, right? At the same time, you have states like Jharkhand, you have states like Kerala, Punjab, that have reported, much lesser, though of course increasing. That takes us to the testing. Now, one good thing is that our testing rate per million has been steadily increasing, and now we are testing more than 5.5 lakh tests per day. Of course, the idea is to now double it, and that's where fixed capacities are being added in the big economic centers of Bombay, Delhi, etc. But our positivity rate has also been increasing, which means while we've been testing more, the infection has also been spreading. And again, while the WHO says that this rate should ideally not be more than 5%, that means for every 100 tests that you have, you shouldn't have more than 5% infected cases. At an all India level, we are around 8.5, which is high. Thankfully, there is some degree of stabilization now in the last week. But again, it's not all India story. You have to look at the states which are particularly lagging. And one can definitely see, and we've been seeing this in the data for the last 2.5, 3 months now, that Maharashtra, Telangana, these are big states with fast increasing infection where the testing rate has been exceptionally low. And it makes you wonder because these are not poor states. I mean, it's quite understandable when you have low testing rates in Bihar or other relatively poorer states. But Maharashtra, Telangana, these are some of the richest states in the country. So it's important to ask these questions. Now, overall, one important thing is that, look, our economic recovery will go through health recovery because people are scared. There is a great degree of fear, among citizens, and that's why I think it's important to put out information regularly. But people don't consume, they don't invest when they have so much fear. So on the economy, it's not just a demand side problem; it's a fundamental uncertainty problem. Right? And that's why we say that the role of the government then becomes one of dispelling fear and providing more information and battling the uncertainty. Rather than, people say if we did a UBI or a cash transfer, we can overcome the demand problem. I don't think so, because even if you put money in the pockets of everyone, it's not going to translate into active demand one-to-one. People will raise their precautionary savings because that's the nature of consumer behavior. Now, at an all India level, another thing to keep in mind is that, we've been living with infectious diseases for decades now. Of course, we are alarmed at 37,000 deaths because of COVID, but it's also important that all of us realize that, in India, 4 lakh people die of TB every year. So infectious disease is very much a part of a public health concern in India. And this can also be considered an opportunity where we truly build our infectious disease ward. And we build, let's say, testing capabilities, testing labs, diagnostic labs at highly localized levels so that all citizens have access to these basic infrastructure. Now, we have often been using bed capacity as a proxy, but clearly what this pandemic has shown, that number one, public healthcare is where the heavy lifting in terms of handling this pandemic is concerned. It's mostly been from the government side or public hospitals. But we do have shortage of healthcare workers, and I think that is becoming the binding constraint, and unfortunately not easy to fix over a short run because it's highly inelastic. I mean, from the supply side, we need to really work hard in terms of ramping up healthcare workers, and we should have more in terms of the training and education part of the story. But just the last slide, economy is contracting. While we are seeing recovery in some areas, we are well below 100% in many. It's a large vicious cycle because it's not just limited to the demand side. The NPAs are naturally, they've been a long-term problem. They will only get aggravated in the current environment. And yet, this will be the new normal. I think firms, institutions, households, we all have to work at a slightly more sort of high cost. We have to invest collectively as a society, definitely from the government as well as from individuals, where new protocols. We will have to maintain social distancing, hand hygiene, mask wearing. This will have to be a new normal until a year and a half to 2 years, when the vaccine is commonly available to everyone, which is the estimated timeline. But until then, this has to become the common sort of a continuous protocol for our day-to-day lives.